Next, though, this morning, self-employed workers who qualify for government support during the pandemic can from today apply for a second and final grant of up to £6,500. Revenue and Customs will contact those eligible. And over the weekend, travellers entering the UK from France and the Netherlands will now face a 14-day quarantine when they arrive back home. So let's catch up with Dr. Duncan Robertson from Loughborough University School of Business and Economics. Duncan, hi.
Morning, Ben.
I think it's fair to say every week we think, well, it's quieting down. Shall we speak to Duncan? And something always happens. Talk us through it then. Where are we with the national cases from the figures perspective?
Well, the national cases are creeping up, and this seems to be a combination, well, mainly just down to more testing happening. But I think there's some thought that this may actually be starting to be a trend. And I think certainly in some briefing that came out over the weekend in the Telegraph, it seems as though there's been some thought about changing the way that the testing is organised to prepare for a second wave. So I think there's maybe an expectation, as you say, with more things opening up, that there could be more cases coming in the not so distant future.
We spoke to a professor a medical professor on the show last week, who was talking about there's a lot of work going on between the numbers of people with it and those that are having to be hospitalised. His sort of analysis of that was that maybe the virus has changed subtly because we're seeing these peaks, but not peaks in hospital. Is that borne out by the statistics?
Well, I think that's so the number of hospitalisations is relatively low at the moment, and this is a bit of a quandary. So, cases are drifting upwards, but hospitalisations don't seem to be going up in any way the same amount. So, part of this may be down to the type of people that are getting it. So, of course, if you're much older, as was the case in the early stages of the disease, where there's a lot of outbreaks in care homes, then you were potentially going to be hospitalised. Whereas a lot of the cases that are emerging at the moment are certainly within Leicester are within the working age range, so 18 to 65. And generally, if you get that disease, you will not be hospitalised as much as someone older. So the amount of hospitalisations is certainly lower than it was at the beginning of the epidemic, and let's hope that continues.
So, look, as far as these sort of hotspots go, though, and the areas where we're seeing spikes, are there more interventions, more areas going on this watch list?
Yeah, so Public Health England has a watch list that they produce every week, and there are, I suppose, about 20 or 30 local authorities that are on that watch list. And let's have a think. There's about 5 are above about 50 cases per 100,000, and that seems to be a threshold. So Leicester is currently at 56, so it's still above that sort of threshold. But there are, and according to Public Health England report, the trend is downward in Leicester. But then you look at the more recent data, and it's starting to pick up again. So it's about the same, and still relatively high in Leicester. But there are more cases that are coming out. So particularly if there's a big outbreak, for example, in a factory, that may put other local authorities right to the top of the list because there's more testing.
I'm not going to hold you to this, but in your waters, what do you think the announcement as far as Leicester goes? Whenever, we're expecting it at some point today.
I don't know. It's a political decision. All these things are partly down to the epidemiology and partly down to the politics of it. But I think that Leicester is still relatively high, even though the trend is downwards. So, you've got the local interventions and the national policy as well. So I don't know, but Leicester is hovering on the margin, so it could, I suppose, go either way.
Well, we obviously await that announcement, and as soon as it's made, people hear about it here on BBC Radio Leicester. Look, just finally, you mentioned Public Health England. Public Health England as an organisation, or a sort of a subset of its government department, is going to be reorganised, disbanded. What's the story with that?
Well, there hasn't been a public announcement. So there's been some briefing in the Telegraph newspaper. But there seems to be, there are two organisations, Public Health England and the new NHS Test and Trace. And it appears to be that the Public Health England, at least the epidemic part of it, is going to be taken into NHS Test and Trace. And it seems an odd time to do it in the middle of a pandemic. And of course, these organisations have very different cultures. And, if you look at the research on when you sort of merge two organisations, there's a paper in 1985 by Buono that says there are major difficulties in trying to merge two different low viable organisational cultures. And it just seems a bit of an odd thing to do, just as, the links have been happening between Public Health England and local directors of public health to reorganise that again. So it seems a bit of an odd thing to do, but I'm sure there are good political reasons for it.
Duncan, thank you so much for coming on the show again. Speak to you next Monday, if that's okay.
Thank you very much.
Right, thanks, Duncan. Thanks. There you are, Dr. Duncan Robertson from Loughborough University's School of Business and Economics, joining us here on BBC Radio Leicester.